my focus today is going to be the problems within the problem. So we have a problem called mental health. All of us are up to our ears trying to introduce strategies to fix it, prevent it, and so on. And I believe that we're missing certain aspects. And the big aspect that I'm going to bring to the table today is we're not doing enough about mental health medication. That's what I'm hoping to bring in today.
Awesome. Thank you, Brian. Allison?
So I think the big issue really is a global demographic phenomenon, and that is the aging population. And, a lot of people call it the silver tsunami. But guess what? With the silver tsunami, underneath the water at the same time moving along, are the daughters and the sons that have to now take care of their aging parents. And it's these people called family caregivers that I feel and we feel are really, really important. And guess what? 75% of family caregivers are at work. So what I really feel today would be a great conversation is how are we going to address that using data, using good old-fashioned lunch and learns, but also using specific platforms that can get out there and give them the right information at the right time. So I think I'm really a proponent of developing caregiver-friendly workplaces.
And they're absolutely right, as you know, and I'm sure all of you here are involved in all kinds of mental illness strategies within your workforce to mitigate it, to deal with it, to prevent it. And of course, as Fernando says, look, you've got to also identify it. We've got stigma, we've got all that stuff. Alison talks about, I can tell you what the causes, some of the causes are. The fact that they have to look after other people within their life, that's adding stresses to them and so on and so forth. Fantastic, very legitimate. And what I'm here to talk about is, you introduce all kinds of strategies, you introduce benefits that says, look, if you have mental illness, call your EAP people, reach out to a psychiatrist, a psychologist, we will pay for a psychologist. You introduce all kinds of, I've heard fantastic programs, and that is admirable and it's absolutely needed. But I'm going to focus today, ladies and gentlemen, on the medication. I'm going to step back and tell you, listen, there is no doubt, and every medical person will tell you, mental illness is a real clinical illness. It is an imbalance of neurotransmitters in the brain within one of the many systems in the brain. You've heard of serotonin systems and dopamine systems and so on and so forth. So it's a real illness. And most psychiatrists will tell you there comes a time when you must use medication to bring that patient back to work. But I'm going to tell you something. If you don't mind, I'm going to walk around. I feel much more comfortable. And I want to focus on this. We do genetic testing specifically for drugs to determine if the drugs work for you or don't, and why, if you are struggling with some drugs, why you are struggling, what is the alternative, and so on. And the biggest area that we work in is, in fact, mental illness. And we've been, obviously it's a small startup, we've been at it for the last 3 or 4 years, seriously, and we've been addressing people that are desperate, because that's are the people that are going to give us money to do a test so they can know. Now remember, we're Canada here, and the governments, provincial governments, pay for all tests. So they come to us and say, well, how come the government doesn't pay for it? Well, the government doesn't pay for it. If you wanted to, they're going to give me money. And the people that have been using it seriously are disability managers or people of that ilk. And they've heard about it, and there's more and more of them coming to us saying, look, I've got this person and this person. I just don't know what to do. And it might be medication. Now, I'm going to tell you something that is absolutely stark. We did this analysis only in January. Over the last 18 months, all mental illness disability cases that we've done, and there's almost 300 of them, 18 months, right? All of them ended up with what we call a genetic mutation score that's very high. Now I'm going to explain to you what that is. You know, our genes mutate. Otherwise, we will all look exactly the same. The reason your eyes are blue and your eyes are not, and your hair is different, and you're taller and shorter and whatever, it's all genetics. And you know, if there was an Adam and Eve, their genes, their descendants' genes mutated just a little bit over generations and millennia. And that is what produced the difference in looks and so on. But it also produces a difference inside us on how we react to medication. And as a result, what happens, we sometimes happen to be born with certain genes that don't respond to certain medications. Ladies and gentlemen, that does not mean there's something wrong with you. It just means that you were dealt this card, and that's how it is. You're short, you're tall, you're pretty, you're not, and so on and so forth. And all of you in this room are pretty. So in all the patients that we looked at with mental illness, 100% of them had some genetic structure that actually says they don't respond to mental illness medication. Now, we started to dig deeper. Then we started to do some, you know, how many people in the general population have these high genetic scores? We found out almost 40% of working Canadians have these high genetic mutation scores for mental illness. Now, I repeat, that does not mean that these people are mentally ill. It doesn't. It just means that if they become mentally ill, and if they then go the route of medication, they're going to have problems. I will tell you, 50% of the population do not respond to medication properly in the beginning. 50%! And that sets off all kinds of problems and a long journey of all kinds of try this medication, it's not working. The doctor says, geez, I don't know. I mean, it's worked for everybody else before. Why is it not working for you? Well, it's not working for me. Well, stay on it for a little while longer. And then you come back in a month or two and say, look, and the doctor then says, geez, you know what, I'm going to send you to, look, I'll tell you, I'm going to send you a psychiatrist. Let me stop and tell you, this is a real fact. 80% of mental illness medication in Canada are prescribed by normal, everyday doctors, not psychiatrists. Now, as a result, what does the doctor know? The doctor doesn't even know what is the disease. Well, you're not feeling well. Okay, I'll give you this or that or whatever. And even when you get to psychiatrists, the psychiatrists would not know what is inside you vis-a-vis genetic mutations. And they're guessing still. So what I'm going to talk about later on in the second segment is what can be done about this. This is interesting. I'm going to tell you, we've analyzed this. We think that's what it looks like. If you have 100 employees or 5,000 employees, 60% have normal genetic mutations for mental illness medications, and 40% don't. Now, if these people develop mental illness, Fernando talks about the 25%. He's right. I mean, I'm using 24%. Sorry, Fernando. But I'm telling you, and Alison is right, or Fernando again is right, 13% actually will report it at some time in their life. 11% will suffer forever. But within these, now they've developed mental illness. 60% of them, or 50% of them, will respond well to medication. So you'll never hear about them. They're fine. They're okay. But these guys will have problems. These are the guys that have lost productivity. These are the guys that will eventually descend into absenteeism and maybe disability. The next stage, I will tell you what can be done about it. been around for a very long time, but only in the last 10 years has it risen, whereby there is some very strong scientific evidence. And, you know, I'm not going to bore you with all kinds of what. We don't use technology too much. Yes, we do. We have all kinds of interesting, you know, you log in, you see all whether you're going to respond to this drug or that drug or whatever. But I'll tell you, we're dealing with real human beings, and we have found out the hard way. You must talk to these people directly. You must take them seriously. You must listen to what they're talking about. And the people that do that within our organization are all registered pharmacists, because we're into drugs. Not the other drugs. You know? And so, you know, I've got technology. How does technology? I don't know what to tell you. Yeah.
But Mark, I can tell you, you are definitely in the right room. We're really excited to have you with us.
Thank you for inviting me.
It's been, we chatted about the ElizBot. It's just an amazing platform. And Fernando, when you mentioned terabytes, or your human impact in the World Wide Web of what that is really, you know, I think it's just art of the possible to get everyone thinking. So for people to chew on, so we're moving into lunch in about 10 minutes. What's a question that you'd want to ask? You know, we have organizations coming in from across Canada who lead health and wellness initiatives within their own workplace. What is, if each of you could ask a quick question that we could chat on now, and then we can move that into lunch. Mark, do you have a question you'd like to ask?
I mean, you know, my question is, when are you going to do something about the mental illness drugs? Because in fairness, a lot of you are thinking, we got to do something within our human resources strategically to stop bullying in the workplace, reduce stress, you know, get people to come forward. You know, you introduce EAP plans, you introduce all kinds of programs, all very, very smart. But my point is, nobody is doing something about, if you have somebody that is struggling with mental illness and is struggling with their medication, you're not doing anything about it. You should.